All right, y'all, welcome back to Level the Playing Field. I'm Dr. Owusu-Akyaw. Let's talk about some sports medicine. Y'all been asking about it. It's time for us to talk about hip arthroscopy, hip scopes. Let's get it. So, as many of y'all know, hip scopes, that's really my bag. So I'm the chair of hip arthroscopy for Ortho Virginia. I do the deputy editor for clinical orthopedics and related research for hip arthroscopy. It's really what I do. Now listen, it's one of the fastest growing parts of sports medicine, like I've said over and over again. But I get a lot of questions like, Doc, what's this about hip scopes? What's the deal and how come people don't understand it? And so I'm gonna break it down piece by piece from start to finish, what a hip scope is about. So the first thing I need y'all to understand is what a hip scope is for and what it treats. So the most common thing you're treating with a hip scope is something called hip impingement, which usually goes hand in hand with something called a labral tear. Now I'm gonna take you back to some anatomy. You might remember I told y'all the hip scope, or the hip rather, is a ball and socket joint. Inside of that ball and socket, you have special cartilage that holds it in place, kind of like a suction cup, and that's called the labrum. So that labrum can get torn or injured for a lot of different reasons. It can be over time, repeatedly from injuries, or it can be one big injury, like for instance, like a big football hit or a car accident. So different ways that it can get injured. But for those people for who it causes pain, it can create this kind of micro instability. I say micro not to mean that it's small to the person, but it's not unstable like your hip's gonna come out of socket. It's more like your hip is moving just a little bit too much, just enough to cause you pain, and your body hates that. So it causes inflammation all around your hip joint. It causes the muscles around your hip to freak out, and that causes pain, and usually people feel that pain in the groin. So when we talk about the hip, a lot of people put their hands up here and they say hands on your hip. When really they're pointing at the iliac crest. That's not really your hip joint to us in orthopedics. The hip joint feels like more down in your groin. So when you're having pain down deep in the groin, that may be hip pain. And in that case, it could be a labral tear or this other thing that goes hand in hand, which is hip impingement. Now the long term for that is femoral acetabular impingement, or FAI syndrome, but we call it hip impingement for short. And what that means is little things about the way someone's ball and socket is shaped might cause bumps on the bone to actually hit the socket and can injure the cartilage and the labrum within it. So a lot of athletes will have these bumps on the bone called cam lesions, and that's a bump that's on the ball side of the ball and socket, or a bump on the socket side, which is called a pincer lesion. Between these two, they can cause damage to your cartilage and labrum over time, or with one big incident. So hip impingement and a hip labral tear can go hand in hand. So the question is, why is there so much confusion about this thing? Well, for one thing, our imaging techniques have improved recently. So MRIs, CT scan, X-rays, those things we've talked about in the past have gotten better. So we know how to diagnose those things better. We also understand more about the hip anatomy and how it causes pain. So back in the day, a lot of people had labral tears and hip impingement, and they're told, and they still are, well, you just have a groin pull, or you have a hip flexor strain, or you just have a glute injury. Not saying those things can't be true, but a lot of times these things are misconstrued. So the number of people I see in my office who come in who have clear hip impingement or labral tears, who have been told for months, sometimes even years, hey look, you just have a groin strain, just work it out. Your hip flexor is just tight, just stretch it out. You know, it's phenomenal. It's a ton of people like that. So now that we understand more about the pathology, about the thing causing pain, we can diagnose it better. So the thing to take away from that is that hip pain, hip joint pain, oftentimes feels like pain down deep in your groin. And that can be confusing because there's a lot of things that can cause pain down in your groin. So we have to be kind of unawares when we see someone who's young and athletic dealing with hip or really groin pain down deep in there, and understanding it's not just a groin strain necessarily, especially if it's not going away over time. So diagnosing the issue is the first thing. So the question is, who does this happen to? Well, it happens to a variety of different people. So people who do a lot of squatting with their sport, people who do a lot of crouching with their sport, people who do a lot of hip extension, so that's like kickers, soccer players, people who do a lot of we call them instability sports, or rather flexibility sports, so like gymnastics, cheerleading, dance. All these different types of athletes can have hip issues for different reasons. It's gonna vary by sport, but there's different ways that they can manifest. So let's say we get to a diagnosis, and let's say someone comes to my clinic and they say they have a labral tear. Now, how do I find out? You might remember an MRI is the way that I tell someone has a soft tissue injury. So that's how I'm gonna diagnose a labral tear. All right, an X-ray could show me the impingement. Remember, that's a bony thing, and an X-ray can show me that. But to see the labrum and the cartilage inside the joint, inside the ball in the socket, I need an MRI. So let's say someone comes into my clinic and they have this MRI and it says they have a labral tear. They automatically need surgery, right? No, not at all. The majority of people with hip labral tears and hip impingement do not need surgery. Let me repeat that again. The majority of people with hip labral tears and hip impingement do not need surgery. How do you get better? Well, everyone always asks me in the clinic, well, I have a tear in my hip. How's it gonna get better without me doing surgery? Well, let's go back to the reason why it hurts. Like I explained to y'all, the reason why labral tears hurt for a lot of people is this kind of micro instability, right? So the majority of people can actually strengthen up their hips around the muscles that hold the ball and socket in place. That's your glutes, your core, hamstring, quadricep muscles, all that stuff around your hips. And they can make those strong enough to make their hip stable. Their hip is stable, so whether or not the labral tear heals itself is debatable, questionable, and probably not important because you feel better now and you can move on with your life. Once again, that is the majority of people. Some studies might say maybe 80% of people. So to that point, there are a lot of people walking around with labral tears and hip impingement who it doesn't bother them. And if you were to MRI a bunch of people just across, a population, you might get a whole bunch of people who have these findings. They might have impingement, labral tears, and it's not bothering them. That's because they've naturally just become what we call copers or compensators. You might remember we talked about that when we reviewed the ACL back in the day. So these people are able to compensate through strengthening the muscles around the hip and grant it stability. Now, if you're someone who comes in with pain, our goal is to get you to be one of those people. We want to strengthen those muscles, and that usually means like physical therapy, to teach you how to do the exercises, to properly strengthen and fix the functional dynamic stabilizers of your hip, those muscles that hold your hip stable. If we can do that, you can move on about your business, and we're done. So then there's a small minority of people who don't get better that way, who try everything else, rest, changing the way they do things, physical therapy, sometimes injections for some people depending on the situation, and they're still not getting better. They still can't do the sport they love. Some people, it even hurts them even just to sit and just to stand, just to live regular life. It's only under those circumstances that we talk about doing my specialty, and that's arthroscopic surgery of the hip. Now, arthroscopic surgery sometimes is thrown around as a term like scope. You might hear knee scope, shoulder scope. In the same way, we can do a hip scope. So arthroscopic surgery being that minimally invasive surgery where I'm using the camera to look around inside of the joint and fix what I need to fix based off that. So the most common thing we're performing when we're doing an arthroscopic surgery of the hip is fixing the labrum and dealing with the impingement. So starting with the labrum, remember it's a suction seal that goes around the socket. And so frequently when it tears, it separates away from the bone of the socket. We fix that by putting tiny little anchors or plastic screws, if you like, that go into the bone that have stitches coming out. And those go around the labrum and then anchor it back to the bone. Now, those stitches are man-made. Our goal is for your body to heal that now that we put the labrum back in place. So it's not a matter of just stitching it in place, it's a matter of encouraging the body to heal it. And we do that by getting the bone on the socket to bleed a little bit. That way when we put that labrum back in place, stem cells, so to speak, or cells that kind of help with growth, come out of the blood and they help that labrum to stick back to the acetabulum, to the socket. So we're fixing the labrum. That's frequently the first step for a hip arthroscopy. The second step oftentimes involves us dealing with some kind of impingement. Now remember, I told you there are two main types of impingement. It's a little deeper than that, but for our purposes, we can break it into two. The pincer type, which is on the socket, and the cam type, which is on the ball. So either way, while we're in surgery, at the same time while I'm using that little camera to move around the joint, I actually have an x-ray machine right there with me taking a picture of the patient's joint so that I can see how their ball and socket moves together and see if anything is impinging when it moves throughout range of motion. So then I can then use a tiny little burr, which looks like a little sanding machine, and actually shave away bone that's causing the problem under close monitoring with the x-ray. So I can make sure that we're not taking too much bone or we're not leaving bone in place that can cause more issues with impingement. So the final step after all this involves the capsule. So what is a capsule? Every joint in your body has a capsule, which is kind of like a tight, thick saran wrap that goes around the whole joint. Every single one has it. Now the hip has probably the strongest, thickest, and biggest capsule of any joint that you have. And so until recently, people thought, well, the hip is so big and strong that its capsule isn't all that important, so we don't have to worry about it too much. But listen to this. The capsule on the hip is so thick that we actually have to make special provisions to get into the hip by sometimes having to cut that capsule open a little bit to get inside. And so we found it's very important that one closes that capsule at the end of the surgery. And that means repairing is stitching it back together before you leave the surgery. Now that's something that wasn't always done in the past in hip arthroscopy, but we now know how important it is for not only the recovery right now for the patient, but for the longevity, for long-term health of your hip. Because we don't want to, while we're trying to fix your micro instability, we don't want to in turn cause micro instability by leaving your capsule open. So 3 major steps, and I'm breaking it down, piece by piece. Labral repair, fixing the impingement, capsule closure. Every patient's gonna have a different situation. Every patient's situation is gonna be a little bit different, but these are kind of the 3 big broad pieces of a surgery. Now, as y'all know, surgery is just the first start of the process. That's just getting you going. We still have a long process to recover afterwards. And when you're thinking about a hip scope recovery, I want you to think like you think of ACL. And like we said, with the ACL, you remember the surgery is only the beginning part. Getting back to your activity is a process of rehabilitation that goes in phases. So in the beginning, we're looking at just getting you to move your hip again smoothly. Physical therapy is gonna help you do that to get your range of motion back. Then we gotta teach you how to walk again safely. So oftentimes you're starting off with crutches. In a lot of cases, you're wearing a brace around your hip, and that's to protect you until you can walk normally again. Once you can walk normally again, we can start strengthening you. Now those same stabilizers we talked about for those people who are not having surgery for this, we now got to get those stronger now that we've had surgery. We got to make them strong enough to protect you so you don't have an injury again. So we're doing that throughout this next phase of physical therapy. And I always tell patients at that point, physical therapy becomes like a workout after surgery. So now you're getting to go do leg press, you're doing squats, you're doing RDLs, you're doing all kinds of things to strengthen those glute muscles and that core musculature. The same way we wanted to prevent having to have surgery in the first place, now that we've had surgery, I want to prevent you from having to have surgery ever again. So we get those strong as possible, and only then, once it's strong enough, do we start doing more impact activity. Now we're talking about running gradually. Now we're talking about doing ladder drills, agility, plyometrics. And if you're playing a sport, this is when we start to integrate some of those activities that are part of your sport. Individual drills to get your one-on-one skills back, and then gradually building you until you're strong enough and safe enough to then re-enter playing appropriately. So you might ask, Doc, how long does that take? Well, that's gonna vary by patient and by person. Now, a lot of people will get back to playing a sport about 6 months after this. It could take a year, it could take 18 months. Everybody's journey here is going to be different. And really, it's not based on timeline, it's based upon your individual recovery and how you've strengthened and gotten your muscles strong. But the last point I'll tell you is that I tell every patient at the end of their journey, so to speak, at least the end of the journey with me, is that this is now a lifestyle change. So you've had an injury to your hip, you can't just stop thinking about your hip. Just like if someone has high blood pressure, they just can't stop thinking about their blood pressure. It's not part of their life. They gotta watch their salt intake, they gotta check their blood pressure. If you had a hip injury, now you have to keep your glutes strong, your core strong, forever. So you gotta make that part of your lifestyle. And so the importance of continued functional strength is important, whether you have surgery or you don't have surgery. For a hip injury, you must keep your hips strong. And like we talked about in the one video, longevity is driven by your hip mobility and functional strength. It'll keep you moving for the rest of your life. It'll keep you doing what you want to do. It'll keep you involved with society and your family. The hip is the center of all things related to movement. So if I can give you one thing to take away from this, is that there's an incredible complexity when it comes to hip scope and hip arthroscopy. We're just starting to touch the tip of the iceberg in terms of our understanding, but we're getting better every year. And studies keep coming out showing us that we can help a lot of people get better from what we thought were just groin injuries through a lot of different methods. So stay tuned, stay with us. I got more sports knowledge for y'all. Make sure you like and subscribe, and we'll see you next time.